how you access care, even your long-term financial picture.
So, our mission today is really to unpack some recent proposals, ongoing developments, mainly in U.S. healthcare and Social Security.
Yeah, we want to get past the sort of sound bites and rhetoric, bring you the key facts, maybe some surprising details from a whole range of sources.
And we've pulled from quite a few. We're looking at official government archives, what the policies say they'll do.
Right? But also independent fact checkers, respected financial news outlets, health policy research groups, trying to get the full picture.
Exactly. So we can understand things like the proposed America First healthcare plan and also the wider money implications in recent bills. Okay, let's dive in.
Okay, so starting with that America First healthcare plan. If you look at the Trump White House archives, the main message is about saving and improving your healthcare.
Right, that's the headline goal.
Yeah, aiming for, quote, higher quality and lower cost care. It's framed as a clear alternative path.
And digging into the details, there are some specific promises about patient protection, patient control.
Mm-hmm. Like guaranteeing protection for pre-existing conditions. That's obviously a huge one for many people.
Always is. And also this idea of giving financial help directly to people, not routing it through insurance companies.
Which connects to putting patients in control of their coverage and care decisions.
Yeah.
That seems to be a core theme.
And part of that control involves expanding things like health savings accounts, HSAs, and health reimbursement arrangements, HRAs.
Right, those tax-advantaged accounts. The plan ties this to repealing the individual mandate.
Which, folks might remember, used to require most people to have insurance or pay a penalty. So removing that is part of this push for more individual control, I suppose.
Exactly. And affordability, accessibility, those are big scenes too.
Okay.
Like making the pandemic era expansion of telehealth permanent.
Oh, that's interesting. So keeping that broader access for millions, including Medicare folks, no matter where they live.
Yeah, it signals a real strategic move towards digital health.
Yeah.
And also expanding affordable options for small businesses, individuals, people may be priced out before.
And on affordability, they also point to state waivers from Obamacare.
Right. Citing examples, Wisconsin, Colorado, Minnesota, Maryland, claiming premium reductions, sometimes significant ones like 11% up to 30% in Maryland.
So the idea there is using state flexibility to lower costs. It does raise that question, though, doesn't it? Local savings versus maybe national consistency.
Definitely a trade-off to consider.
Yeah.
Then there's cost control and transparency. Lowering prescription drug prices is a major focus.
We hear that a lot. How are they proposing to do it?
Well, they highlight things like record generic drug approvals, cutting insulin costs for seniors, opening the door for potentially cheaper drug imports from Canada.
Okay. And what about the surprise medical bills everyone hates?
Yeah, the plan commits to prohibiting them, kind of building on what was done for COVID-19 care.
That would be welcome news for many. And transparency overall, getting prices up front.
That's in there too. Described as the most aggressive action in history to ensure patients know costs before getting care, plus efforts to cut waste, fraud, abuse, especially in Medicare.
So it's about the money, but also about the actual care, right? Innovation, quality.
Precisely. The archives mention specific actions for conditions like COVID, substance use disorder, kidney disease, plus broader goals like ending HIV/AIDS.
And giving patients control over their health data. That seems to fit the control theme.
It does. Also improving access to things like direct primary care and the right to try for terminal patients. It's presented as a pretty comprehensive vision.
Okay, so that's the overview from the archives. Now let's zoom in on one piece. Medicaid. There's been a lot of talk, particularly from President Trump, that any proposed changes are only about cutting waste, fraud, and abuse.
Right. The claim being, we're not doing any cutting of anything meaningful. Sounds straightforward.
Right.
But independent fact checkers see it differently. Al Jazeera, for instance, looked at that specific claim and called it false.
Okay. And what about the potential impact?
That's where the Congressional Budget Office, the CBO, comes in.
Yeah.
Their projection for the House bill's changes was stark. Potentially 8.6 million Americans losing health care coverage.
Wow. 8.6 million. That's a huge number to contrast with just targeting waste.
It really is. It highlights that tension between, program integrity and maintaining coverage levels.
So let's maybe define terms. CMS, the Centers for Medicare and Medicaid Services, what do they consider fraud, waste, and abuse?
Okay, so fraud is knowingly deceiving for money. Waste is like Overusing services causing unnecessary costs.
Hmm.
And abuse involves provider actions leading to unnecessary costs or not meeting professional standards.
And do any parts of the proposed bill fit those definitions?
Well, you could argue some do, like requiring states to check Medicaid eligibility every 6 months instead of yearly.
Okay, more frequent checks.
Right. Or stricter rules for verifying addresses. You could frame those as waste prevention.
But is that the whole story?
Not according to experts like Leighton Koo at George Washington University or Robert Rudowitz at KFF. They basically say the major changes aren't really about fraud or waste in the technical sense.
So what are they about then?
They argue it's more about reflecting specific Republican policy preferences, fundamentally changing who's eligible and how the program works, rather than just trimming misuse.
Okay, so let's unpack those key policy changes. One big one is work requirements, right?
Yes. The proposal mandates 80 hours a month work, community service, or education for most Medicaid recipients aged 1964 who got coverage under the ACA expansion.
80 hours. What does the research say about who that affects?
Well, this is where a KFF analysis is really insightful. It found that nearly two-thirds, 64% of working-age folks on Medicaid already work.
Oh, interesting. So it's not necessarily targeting people who aren't working.
Not primarily, no. KFF suggests many who might lose coverage wouldn't lose it for lack of work, but because of the sheer administrative burden, the paperwork needed to constantly prove they meet the requirements.
So bureaucracy becomes the barrier.
Exactly. Professor Benjamin Summers at Harvard called these requirements a fundamental change to eligibility, adding immense bureaucratic obstacles, not just a fraud measure.
Got it. What else is in these proposals? I know there was something controversial about immigrants.
Yes, there's a provision aimed at making it harder for states to use only state funds to cover undocumented immigrants.
How would that work?
So currently 14 states plus D.C. cover some undocumented immigrants, like children, sometimes adults, using their own money. The bill says if they continue doing that, the federal government would cut its share of Medicaid funding for all citizens in that state from 90% down to 80%.
Whoa. So states face a choice. Stop covering those immigrants with state funds or take a big hit on federal funding for everyone else.
That's the pressure, yeah. It could force really tough budget choices, potentially leading to citizens losing benefits or coverage.
That's a major potential consequence. Any other noteworthy provisions?
A few others. A ban on using federal Medicaid or CHIP funds for gender transition procedures. Also, a moratorium on new or increased provider taxes.
Those are taxes states sometimes use to help fund their share of Medicaid, right?
Correct. Proponents of the moratorium argue states use them to sort of game the system and draw down more federal matching funds. The bill also pushes for $35 copays for many services.
Which could be a barrier for low-income folks.
It could. And limiting retroactive coverage for care received just before applying to 1 month, down from the current 90 days.
So a lot of moving parts with potentially big impacts. How does the public feel about all this?
Well, the KFF health tracking poll paints a really interesting picture. Very few adults, just 17%, actually want Medicaid funding cut.
Really, only 17%.
Yeah. Most people either want it increased, 42%, or kept the same, 40%. And that holds true across party lines. Majorities of Democrats, Republicans, even Trump voters feel this way.
Is that because people have personal experience with it?
Seems likely.
Yeah.
Over half of all adults, 53%, say they or a family member have received help from Medicaid. That includes nearly half of Republicans and Trump voters.
So there's a disconnect between some policy proposals and broad public sentiment, and even the experience of supporters of those policies.
It appears so. And when asked why these changes are being proposed, 3/4 of the public think it's more about reducing federal government spending than actually improving how the program works.
Interesting perception. Does providing more information change opinions?
Dramatically. Take work requirements. Initial support is 62%.
Hmm.
But tell people, most beneficiaries already work and face paperwork hurdles. Support plummets to 32%.
Wow.
Same with cutting federal funding. Initial support is 40%. Tell people 20 million could lose coverage. Support drops to 24%. Shows how framing and details really matter.
Absolutely. And what about the impact in rural areas?
That's a critical point. Medicaid covers a higher percentage of people in rural communities. Cuts there could mean more hospital closures, fewer doctors, worsening shortages that already exist.
We already hear about those shortages.
Right, like a third of rural residents say they don't have enough hospitals, over 70% say not enough specialists. And there's also just general confusion
Confusion about what?
about what Medicaid even does.
Yeah.
62% don't realize it's the main payer for nursing homes and long-term care for low-income seniors and people with disabilities.
Yeah.
And almost half are wrong or unsure about whether undocumented immigrants get federal health insurance. They don't.
Okay, so let's unpack on the healthcare side. Let's shift gears a bit now to Social Security and some broader financial policy ideas.
Right. President Trump made a promise to eliminate income taxes on Social Security benefits.
Along with tips and overtime, I think.
Yes, those two. Focusing on Social Security right now, about 40% of beneficiaries pay federal income tax on some of their benefits.
And why is that percentage so high? Or rather, why has it grown?
Because the income levels where benefits start being taxed haven't been updated since way back in 1993. So as incomes rose over decades, more and more people crossed those old thresholds.
Okay, so eliminating that tax sounds like a win for seniors. What's the catch?
Well, the potential impact on the program's finances. Bankrate calculated that this tax brought in over $50 billion, that's billion with a B, to the trust funds just in 2023.
50 billion, that's not insignificant.
Not at all. It's about 3.8% of the fund's total income. Bankrate warns that getting rid of it could expedite benefit cuts down the road, especially since there's no clear plan presented for how to replace that funding.
And who benefits most from the tax cut?
Primarily higher income beneficiaries, since they're the ones paying the tax now. And this is all happening when we already know the main Social Security Trust Fund faces insolvency around 2035.
Meaning potential automatic benefit cuts around 17% if nothing changes?
Exactly. And polls show 73% of Americans are worried about the program running out of money. So removing a revenue source is, well, it's a concern.
Okay. There were also some strong claims made about fraud within the Social Security Administration itself.
Yes, talk of shocking levels of incompetence and fraud, specifically mentioning millions of deceased beneficiaries, supposedly still getting checks.
Millions? Did the Inspector General find that?
Not quite. A 2023 OIG report did find millions, nearly 19 million records, actually for people over 100 who didn't have a death recorded.
Yeah.
But they found only a tiny fraction, about 2%, were actually still receiving benefits.
Okay, so a discrepancy between the records and active payments.
Right. And the SSA basically pushed back, saying it would be really expensive and not very useful to constantly update records for people not receiving benefits anyway. So the scale of active fraud involving deceased beneficiaries seems much smaller than implied.
Understood. Now, related to the SSA's operations, staffing cuts.
Yeah, this is a big one. Plans announced to cut 7,000 jobs, about 12% of the workforce, citing executive orders about federal efficiency.
But haven't SSA staffing levels been falling already?
They have. They're apparently at a 50-year low. This is happening while the number of beneficiaries went up 25% between 2013 and 2023, and operating budgets actually decreased 17% in real terms over that same period.
Fewer staff, less money, more people needing help. That doesn't sound sustainable. What's the impact on service?
We're seeing office closures. 47 branch locations across 24 states either closed or planned to close. Some are labeled true termination,
Meaning no replacement nearby.
potentially leaving people in rural areas over 100 miles from the nearest office. Experts are pretty blunt. They say these cuts will worsen already long phone wait times and directly hurt people who need that face-to-face help.
Okay, that's a lot on Social Security. Before we wrap up, were there other broader financial items in these legislative proposals? Tax changes, maybe?
Yes, definitely. Things like extending the 2017 tax cuts, increasing the standard deduction, which could keep rates lower for many families for longer.
But also changes to deductions. I remember hearing about SALT.
Right. The state and local tax deduction. The Senate proposal would shrink the cap back down to $10,000. That hits homeowners hardest in high-tax states like California and New York. Could mean a bigger federal tax bill for them.
What about seniors specifically? Any other tax breaks?
There's a proposed special deduction for people over 65, bumping up to $6,000 per person, but it phases out for higher earners. So maybe helpful for some, less so for others.
Okay. Anything else jump out?
Well, the Senate version keeps green energy tax credits around longer than the House version. And there's talk of making tips and some overtime pay exempt from federal income tax, maybe for a few years.
That would require careful record keeping, I imagine.
Definitely. Oh, and bringing back the deduction for car loan interest, up to $10,000. That hasn't been deductible for a while.
Interesting mix of things. But what's the overall bottom line, financially speaking? The deficit impact?
Official projections suggest the whole package, as proposed, could add about $2.5 trillion to the deficit over 10 years.
$2.5 trillion. That's significant. And crucial to remember, these are still proposals, right? The House and Senate aren't perfectly aligned.
Not at all. Negotiations are ongoing. Things could change quite a bit before anything actually becomes law. It's very much a fluid situation.
Okay, so let's try to bring this all together. We've really taken a deep dive today into, well, this kind of dual nature of policy proposals.
Yeah, you have the stated goals, improving healthcare, helping finances, but then you have the really complex, sometimes contradictory details when you dig into specific legislation for healthcare and Social Security.
And we've seen how different sources, government archives, fact checkers, researchers, polls, offer really different perspectives on what these policies intend and what their impact might actually be.
It really underscores how directly relevant all this is to you, the listener. Your financial planning, your access to healthcare, the future of programs like Social Security and Medicaid that millions depend on.
So, thinking about all these potential shifts, the conflicting reports, the fact that it's all still being negotiated, what does that mean for you as someone trying to stay informed and plan ahead?
How might these changes, if they happen, shape your decisions? About health coverage, about retirement savings, maybe even about where you live if state policies diverge significantly.
Yeah, and maybe the bigger takeaway is just how vital it is to look beyond those initial headlines.
Absolutely, to really try and understand the details, the context, the potential ripple effects, not just what's proposed, but why it matters and what it could mean for your own life and your community. It really is about digging deeper.
Welcome to Financial Area and the Deep Dive. I'm Paul.
And I'm Rachel. Great to be here. Today, we're cutting through some of the noise surrounding U.S. policy changes.
That's right. Specifically, we're looking at things that impact your wallet and your health, personal finances, healthcare. These big legislative debates can feel distant.
They really can. But they directly shape, well, your daily life, how you access care, even your long-term financial picture.
So our mission today is really to unpack some recent proposals, ongoing developments, mainly in U.S. healthcare and Social Security.
Yeah, we want to get past the sort of sound bites and rhetoric, bring you the key facts, maybe some surprising details from a whole range of sources.
And we've pulled from quite a few. We're looking at official government arcs.
Policy changes.
That's right. Specifically, we're looking at things that impact your wallet and your health, personal finances, healthcare. These big legislative debates can feel distant.
They really